Hi guys, it's Jill, your top heavy yogi again. This is Penny, or at least it's Penny's tail. She may or may not make an appearance. The rest of her, at least, may or may not make an appearance while we're shooting this. I'm on my fifth take, so I'm really hoping to just get through without being distracted by the cat. Uh, so today is Thursday, February 18th, which means my mom's birthday is tomorrow. So happy birthday, Mom, because I know you watch these videos. And it's also 6 weeks to the day after my shoulder surgery. And I'm not having a good day for a couple of reasons. And I think it's important during this recovery process to talk about the good stuff too, not just, or to talk about the bad stuff rather. I've already talked about some of the good stuff, but to talk about the bad stuff. Yesterday, I filmed a video where I showed you some of my physical therapy exercises and went through some of my range of motion to show you where I'm at this point. And I haven't watched it yet, so I don't know for sure if I'm posting it or if I have to re-record. So that may or may not come up, and then you might be getting videos out of order chronologically, and you'll just deal with that if that happens. But today, I just wanted to talk to you about the recovery process, because recovery is not linear and it's not the same for everybody. And you will have good days and you will have bad days and you will have better days and you will have worse days. And I think for those of us who have a regular physical practice or are athletes or are active in some other way, this is the point. Oh, Penny is now peeking up over the camera. But this is the point at which things really start to be challenging, because for the first few weeks after your surgery, you're wearing a sling and you're not really aware of all of the things you can and can't do because you're not supposed to do anything. The only time you can take the sling off is for changing clothes and taking a shower, and that's it. So it doesn't really hit you what's going on with your body, I think, in my experience, until after the sling comes off. So I got to take my sling off 2 weeks ago. You might have noticed I'm not wearing a sling right now, and this is my left hand waving at you. Yeah, so 2 weeks ago was the day. So 4 weeks to the day after surgery was the day I was allowed to remove the sling. That was also my first day of physical therapy. I've now had 3 physical therapy sessions. I was supposed to be in physical therapy right now, but the session got canceled because we have a lot of snow out and the roads are not in great shape. So I'm taking that time to record this video now. On Monday, I saw my surgeon for the first time since my surgery. I did not see him after the surgery because I was still pretty zonked on painkillers. With your cat butt. I was still pretty zonked on painkillers, and so he talked to my husband, and then the first follow-up appointment I had was with the physician's assistant. And I'm really sorry for the glare in my glasses, but I'm not putting contacts in to make this video, so I guess I'm not actually that sorry after all. But yeah, so I saw the surgeon, who is great. I like him a lot, and I think it's important to have doctors you like a lot, especially if they're going to be slicing you open and you're going to be seeing them several times over the course of a few months for follow-ups. So we talked for a bit about how I'm feeling, where I'm at, and then he did some range of motion tests on me. Right now, my range of motion is less than he normally sees for 6 weeks out, which is of course concerning to me as a yoga practitioner and a yoga teacher. But he said that for people who are loose jointed is the phrase that he used. So for people who are loose jointed, it's better if we're too tight at this stage than if we're too loose. Because if we're already loose at this stage, it's a sign that we're just going to wind up hurting ourselves again. So better in his eyes, at least in his professional opinion, which I'm inclined to trust, that I'm tight. But the tightness is really rough. The cat just got back on my lap. I was going to show you. So this is as high as I can raise my arm right now. And you'll see my trapezius had to go way up. So if I keep my trapezius down, these are my fingers here. My arm level, the camera's too close for you to really see, but it's only about the center of my chest. Out to the side, that's as high as I can raise it compared with this of my right arm. And extending it that far and holding it is pretty painful. Trying to reach around behind my back I couldn't even reach into my back left pocket at this point. That's how limited my mobility is in that posterior plane of my body. Um, Depending on what sort of movement we're talking about, I have no more than 50% of my normal range of motion. Interior rotation, I have more than exterior rotation. Again, anterior more than posterior movement. Very little strength. And in fact, if I can disturb the cat, I'm going to take my sweater off my shoulders for a second. Okay, Penny, we need to move now. All right. So this is, let me move my hair back too. This is what my shoulders look like at this point. You can see this is the operated arm. There's one of the, cat is back, one of the 4 or 5 scars that I have. This is also the most pronounced, and it's still pretty small and it'll clear up a lot. But the other thing that I wanted you to see is my trapezius muscle, especially. So this is my unoperated arm, and you can see like this is lots of chaturangas. And then this side, my shoulder just slopes straight down, and I'm carrying my left shoulder lower. I have to kind of make an effort to keep my shoulders aligned. So I'm carrying it slightly lower and slightly further forward than I would normally carry my shoulders. But there's like a really visible difference between also the mass of my shoulder is significantly smaller on this side than on the other side. I don't think you'll be able to see that on camera, but like it's not as deep, or there's not as much diameter to my shoulder, I guess is what I'm trying to say. So the doctor said I'm stiffer than normal, but that's okay. The physical therapist is working with me. I guess starting next week, it's going to be twice a week. It was supposed to be twice a week starting this week, but then the snow happened. And I'm doing the exercises at home. I'm supposed to be doing them twice a day. Most days I'm doing them once a day. And I'm not sure if I'm going to do any of them at all today because I don't feel great. So let me tell you about what's going on right now. I am allowed to have the sling off, and in fact, I'm encouraged to have the sling off during the day. For the first couple of weeks, remember I'm now 2 weeks since I could take the sling off. For the first couple of weeks, I wore the sling when I was teaching so that I didn't have any sort of temptation to use my left arm if I slipped, if I started to demo something and wasn't thinking. So the sling was there as a safety net for me. I was also wearing the sling on those occasions that I was outside because it's wintertime in Philadelphia and we're getting hit by this polar vortex and there was ice out. So my physical therapist wanted me to wear the sling if I was outside because if I tripped and fell, I wouldn't have that reflex to stick my left hand out to try to catch myself. The problem with wearing the sling is that you can't wear a jacket when you have the sling on. So I had to make the choice between being warm and being safe, which means I haven't been outside a whole lot because I can be warm and safe if I just stay at home. As you'll see, I'm in the same room as the last video. I'm in the basement. I'm not in my home studio right now. I'm still teaching from that room, and the video that I shot yesterday that may or may not see the light of day was shot in that room. But I am subterranean. I have one window over there, which isn't helping with the light situation at all. So you get to stare at these circles in my glasses. So I'm not getting a lot of sunlight. Even if it weren't gray outside, I wouldn't be getting a lot of sunlight. The cat is off my lap, so I can pull my sweater back up. And I have seasonal affective disorder. And so I don't like winter. And I don't like winters like this, especially where we just get lots of snow and lots of ice. I grew up in West Texas in the desert. Not that Texas is doing great right now, but that's the climate that I'm used to. And so there's this combination of recovering from the surgery and the weather and the isolation of COVID-19, the coronavirus pandemic and the quarantine. I haven't seen the face of anyone who is not my husband or a medical professional or a fellow patient in a medical practitioner's office since I think Christmas Day. Some friends came over. It was warm enough that we had a champagne toast outside. And so it's an interesting combination, that loneliness and that sadness / anger at the weather and the physical recovery. This is supposed to be a yoga channel, but I think it's important to talk about mental health too. So I want to be transparent about that. But I'm going to focus mostly on the physical stuff because I feel like that's where these videos can be the most helpful. So my physical therapy exercise regimen right now is about 20 minutes. It's several exercises. My therapist uses a service called MedBridge, I think, and it pushes the exercises through to an app that has a timer. You do your exercises along with the timer, and it makes things much easier than trying to remember what your exercises are and what order to do them in and all of that. And the exercises suck. And it's not that they're hard, like on a cognitive level. If you were to look at these exercises, having not gone through an injury, you'd be like, oh yeah, no problem. I can do those 10 times over in 5 minutes and I'll be, it won't bother me at all. But when you're recovering from this surgery, the cat is back. You're recovering from the surgery and you've got the tightness of the surgery where you were operated on, and then all of the protective muscles that have decided to engage also. These exercises are so unbelievably hard. And nobody talks about not just how hard these initial exercises are, but how exhausted you are by the time you get to the end of these exercises. And I'm going to try not to cry. So because I've been sleeping in this sling for the last 6 weeks, I have not slept well for the last 6 weeks. I've never been a great sleeper in that I procrastinate at bedtime, and it takes me a long time to fall asleep. But usually once I'm asleep, I stay asleep. Usually. There's nothing loud. Right now, I'm not procrastinating so much at bedtime because I'm still reliant on my husband to help me get undressed at night. Something like this, the sweater I can take off. The tank top that I'm wearing underneath it, I cannot take off on my own. So we go upstairs when my husband is ready for bed. He helps me get ready for bed as much as I need. And then last night I was able to shower and dry myself off on my own, and he was already asleep when I came out. But because I'm wearing this sling when I sleep, I'm not sleeping well. It takes forever to get comfortable. And then if the cat walks across the bed and steps on my arm, that hurts. And if I start to wiggle too much in my sleep and my pajamas roll up under the sling, that's uncomfortable and it wakes me up. So I'm tired already. Like my baseline right now is tired. And then you layer the physical therapy exercises over the top of that. And I still have to teach and I have to do my day job. And I'm at a point where I am either in pain or exhausted all of the time. And they don't tell you about this. Like, you know that you are going to be experiencing some discomfort, and you know that you are going to have to work after your surgery recovery if you want to get back to like a somewhat normal life. But I think more people need to be honest about just how hard this is. And all of the things that you're going to expect by 6 weeks post-surgery that will be no problem for you, that remain a problem for you. I'm at a point where I can eat with both a fork and a knife in both hands, but only if I'm eating at a coffee table, because I can have my arms pointed down for that sawing motion, but I can't have them up. Like the height of a dining table is too high for me. If I'm eating soup, I need to eat it at a dining table or the tray table I'm using right now to hold up my computer, because then I have to lean too far over to the bowl to avoid making a mess. But anything that requires a fork and knife, I have to eat at a low table. And I mentioned like the pain and where it comes from. And yeah, like sometimes when I'm doing my exercises, what hurts is actually my shoulder where I was operated on. Usually what hurts. What hurts on a regular basis, even when I'm not doing my exercises, are those protective muscles I mentioned. So like my pectoral muscles, especially where they attach to the humeral head, like where your chest muscles connect to your arm muscles, are really tight. I'm constantly massaging them. And today I was on a video call with several people, but one of them is a chiropractor, and he stopped the call to make sure that I was okay. Where it hurts the most right now is my bicep. I'm going to use my right arm to kind of demonstrate. But so like, actually, there's no way because I can't point to it with my left hand because my hand doesn't go that far across my body. But just imagine like that curve on top of your bicep where we think of like that really defined muscle is. Imagine if it were just making a fist permanently all of the time. And that happens because you're wearing a sling for 4 weeks for 23-ish hours a day with your arm bent at a 90-degree angle. If you've ever done bicep curls, you know that it's that action from 90 degrees up where you're getting a lot of the engagement from your muscle. There's engagement on your way out when you go all the way down too, but a lot of that is isolated in that 90 degrees from when your elbow is bent to when it's up at your shoulder. So this little muscle right here, I'm going to call it a little muscle because it's atrophied. It feels like there's a tennis ball would be softer than what this feels like. It feels like there's like a field hockey ball, I guess. Those are heavier and denser in my bicep. And there's not a whole lot I can do about it. I'm allowed to take anti-inflammatories now, so I've been taking ibuprofen like it's my job. Like the big 800 milligram ibuprofen pills that you can only get by prescription. I've been taking those, the minimum time between. And I think I mentioned in another video that after surgery, when I had the narcotic painkillers, I was taking the minimum dose at the maximum interval because I was feeling fine. This sucks compared to that. And the narcotic painkillers won't really do much for it because it's a muscle spasm. If I had any left at all, I think I might, but we're not going to check on that right now. So like everything hurts already, baseline. Like muscles that you don't realize you use all of the time hurt. And then you do your exercises and they hurt more, or they hurt in different places, and you're exhausted and you're cranky and you still can't make your own dinner, and you can get yourself dressed kind of, but you can't get yourself undressed. I'm wearing leggings for the second time since my surgery. The first time was because those were the only clean pants I had and I was still wearing a sling and it was really hard to get them on. Second time is today, not wearing a sling, figured maybe I would try it out. And these are super stretchy leggings, still pretty hard to get on. And like I said, I can't take my shirt off. Anything with sleeves that doesn't open in the front, forget it. I can almost get my hair up in a ponytail if I try really hard, but the chances are the ponytail will be kind of pulled toward my left side, because in order to get anything on my left side, I have to lean my head over and just kind of push. And you don't think about the toll that this stuff takes on you, like just the interruption to your everyday life and what that does, what that means. And when you are a yoga instructor or you are a yoga practitioner and you are used to spending 4, 5, 8, 10 hours a week on your mat, nobody talks about the mental toll that can take. too. I cannot really practice asana right now, and it's going to be a while before I can. There are certain standing poses I can do. There are certain seated poses I can do to a certain degree. You know, Warrior Two, I can get into the stance, but I can only raise this arm up. Side angle, I can, Parsvakonasana, I can do it with my right foot forward and my right arm on my thigh or on the ground, but I can't get that left arm up overhead. And it's not really safe for me to do a lot of these things, like any standing balance poses, because if I were to fall, I can't catch myself on my left arm or else I'll really be in trouble. And I'm going to confess something right now that probably makes me a bad yoga teacher. It definitely makes me a bad yoga teacher. I don't really meditate outside of yoga. I've tried. It's not that I haven't tried. But it's very hard. Now the cat is making noises. She got off my lap, but she's making noises. It's very hard for me to meditate if I don't have some sort of guide. Like I'll use apps and stuff sometimes by myself. I love leading meditation. I like to think I'm a great leader of meditation. And I love meditating when I'm taking somebody else's class. But I'm realizing that because I'm not practicing physical asana right now, I'm also not meditating. And that's probably contributing to what's going on inside my head right now. So if you are a yoga practitioner or a yoga teacher and you're watching this video to get the yogi's perspective on this shoulder surgery, and not just because you're somebody who is interested in what's going on with my shoulder, I would really encourage you to find a way of preserving at least that part of your practice. And I'm going to try to practice what I preach on that in that regard. I know I am going to get better. I know that eventually I will get back to a functional range of motion, and then I'll get back to a practitioner's range of motion, and then I'll get back to what my normal range of motion is. I also know that I'm going to have to be careful for the rest of my life so that I don't re-injure my arm. Now that it's been operated on, a second surgery would be much more intense because they don't leave a whole lot when they're disconnecting and reconnecting your labrum. It's not like they can just go in there again and like tighten it up. Like it's bad if you re-injure. And I'm going to do as much as I can to make sure I don't hurt my right arm, because as hard as this has been with the operation on my non-dominant side, I can only imagine how much harder it would be if I had to have my right shoulder, right arm velcroed to my side for 4 weeks and then still pretty much unable to do much for several weeks thereafter. If you are thinking about having your labrum repaired and you've still been kind of living life with little pain or little inconvenience, I wish that I could tell you that I recommend that you go forward with surgery now. I don't have the sort of hindsight and sort of perspective to allow me to give you that advice just yet. I hope that I'll get there. The other people that I spoke to who had this surgery said that it was worth it. So I hope that I get there. Only you know what is right for your body. You are going to heal differently from I am. You are going to process this in your head differently from how I am. You're going to get different medical advice and see a different physical therapist from who I saw. I'm getting emotional again. So I can't encourage you to have the surgery, but I also can't discourage you from having the surgery. I can tell you that if you are having the surgery, having it during the pandemic when everybody in the winter, when everybody is stuck inside anyway, is not the worst thing in the world. I do wish that I could have people over to come keep me company and give my husband a night off. But I also have a feeling that wearing that sling in the summertime would be super uncomfortable. So I think I did right in this one regard, at least. I've been talking a lot and my throat is getting scratchy, and if I drink water, you will hear me swallowing. So I'm not going to do that for any of you who have misophonia. Misophonia? You know what I'm talking about. But I lost my train of thought. Yeah. I'm going to post something else later when I'm clear-headed and in a better spot. And I may or may not post that video that I recorded yesterday. If I don't post that, I'll just make another one. I've got more exercises that I can show you now. This is not easy. Nobody talks about that. Like, for what is a relatively minor surgery. People talk about things not being easy if you have surgery to repair a compound fracture, or if you have surgery that affects one of your major organs. I have 4 or 5 incisions that are less than half an inch long. My surgery took 40 minutes. I had no idea that by 6 months after surgery, I would still feel the way that I feel, that I would possibly actually feel worse than how I felt 2 weeks after surgery. My space heater, which I forgot to turn off when I started recording, so I hope the microphone isn't picking it up, just kicked off and immediately kicked back on. I'm gonna go take an ibuprofen and put some ice on my shoulder. And I'll see you all very soon. Take care.